Just to give you why is Kurt Schrader even remotely interested in this healthcare reform. Some of it's self-interest like yourself with my own businesses, my own experience. I know that the current system is unsustainable and broken, and pretty soon people are all either not gonna have health care or go bankrupt trying to get their health care, and that doesn't make sense to me. Right now, you hit the nail on the head. The real poor that don't work get better health care than the people at my clinic, and at less cost. And that's wrong, in my opinion. In my opinion, that's wrong. I don't mind helping those that can't help themselves. I'm okay with that. But at the same time, I want to make sure the people that struggle to make my business a success and don't get paid a heck of a lot. I'd love to pay them more, just by like most of you guys, but you can't afford to do it. It's called business. And I want to make sure they have access, some sort of affordable access to the system. And I don't know if the numbers are perfectly correct in these bills. Is the 72 and 65 the right number? Are the income levels, is that the employee numbers correct, the part-time issues? And I'm hoping that there will be a couple things that will happen, that as we finish off on whatever ultimate bill gets voted on, that some of these questions will be answered. And that we'll move over the next 3 to 4 years. We got several years. It's not supposed to take effect till 2013 or 2014, except for pretty much the pre-existing condition piece and a couple of, frankly, gratuitous issues. We'll hopefully nail the rest of that stuff down. I am concerned about the cost containment. That was my big issue, actually voting for the House bill. I ended up voting for the House bill, not because I would vote for that as a final version, but to move it along. They actually did reduce the cost, almost $200 billion. I and a number of others in the House Blue Dog Caucus put up a big fight on that. I've been very clear with the administration. I've been very clear with my leadership that I much prefer the cost containment in the Senate bill. The Senate bill, according to the Congressional Budget Office, is scored as, well, reducing the deficit in the next few years, but a lot of that's just moving numbers around. They can play games with when programs take effect and stuff, so I take that with a grain of salt. But the number I look at that makes me feel a little better, and these guys don't have, as a matter of fact, I know they don't have a dog in the fight because they scored the original House bill is costing us a whole bunch more. That got my leadership all up in arms. They had to, had to figure things out to make it cost less, so I know they are not trying to please everybody. And the Senate version, they actually said would reduce the costs anywhere from 1/4 to 0.5% going forward over the longer term. And that I put a little, even though it's a fuzzier math because you can't predict too far out in the future, I put a lot more credibility into that than trying this deficit window that you can play games with. And if they do that, then frankly that lowers our deficit, which is a big deal, anywhere from 2 to 3%. So the cost curve, to me, is the big issue. And everything that's in either more cost containment in the House or Senate bill, I've got my staff making a list of those things, and that's what I'm going to be advocating for, so that we have as much cost containment as possible. I don't want to end up like Massachusetts, that is growing broke rapidly because of their universal health care system, where they did no cost containment at all. But I do have to believe that if we get everyone in the pool, and that's why the insurance companies have been at the table, at least until the Senate reduced their penalties. They were at the table because everyone had to be in the pool. And if you get the healthy people in the pool, then you're not just paying for the sick people, and then it actually lowers the costs actually for every one of us going forward. If we're not paying that uncompensated care. I don't know about you guys, but I'm tired of paying for the guy in the emergency room. And I don't think that's right. And I'm a firm believer that everyone should have some skin in the game. I don't care how, well, okay, I'm supposed to be a Democrat and very kind, and I like to think that people with zero income, okay, or if you're at the poverty level, 14,000, that's what, 133% of poverty, 14,400, I'll give them free health care. But every other person should pay something. And I know from my work in the state legislature that even people with no jobs and no income, 80% of those can find resources, have resources available to them to take care of themselves and pay, a $10 premium or a dollar copay or 50-cent copay. They have resources. And to your points earlier about utilization, that's a big piece. If people don't have, in my opinion, some skin in the game, we're all well-intentioned people, but you can tend to overuse things. If it's free or darn near free, you don't use things appropriately. And I think it's important that everyone have, and what's the balance? We're picking numbers here to start with. I hope and feel strongly they're open to massage. How much What should the premiums be, and what should your subsidies be to make sure it's affordable, yet people don't take advantage of it and drive the cost up going forward. So I'm on your, I guess all I'm saying is I'm with you. There are some things in here that make me feel a little bit better than you right now about it. And our attention is on that. My attention is bingo right on that going forward. Cost containment is huge, gotta be better than the House bill, or we're not voting for it, even the second version of the House bill. Second is the Medicare reimbursement. As you guys know, even though most people in this room aren't on Medicare yet, we'll all be there eventually. And right now, Oregon's Medicare reimbursement is only half of what most of the rest of the country gets. What is that? That sounds crazy. The reason is, when this program was set up 40 years ago, it was based on number of services you run. The people back east, of course, have better hospitals and more intelligent doctors and better students and better facilities, and of course they need more reimbursement. So that's the way it was set up 40 years ago. I would respectfully disagree with that characterization, obviously, here in the 21st century, where it's a global economy. I pay the same for all my stuff in my veterinary clinic as the guy does in New York City. Maybe his rent's a little more than mine. Okay, fine, but it's not twice the reimbursement rate. So in the House bill, a good piece of the House bill that we should all argue for is to make the Medicare reimbursement language that of the House bill, which basically says we transition, because we're kind, gentle people, over 4 years off the fee-for-service to where the director says, I'm gonna base my reimbursement to those doctors, hospitals, states, regions that are getting better results. And Oregon and a couple other states do huge in that area. And that's important not just if you get old, but because a lot of other rates are tied to what the Medicare rates are. Your own doctors, your own hospitals, or even private care, there's a relationship there that isn't really spelled out, but is there. So it would be really helpful for us to make healthcare more affordable for us in the Northwest.